welcome back to The Explainer. So, you're sitting there, staring down the barrel of life after 10th grade, wondering what in the world is next. Well, today, we are diving into an incredibly stable, totally fascinating path, healthcare and paramedical fields.
Right? Completed 10th grade, now what? It's literally the biggest question on your mind right now. I mean, the pressure to figure out your whole life at this stage, it's stressful. But what if there was a path forward that didn't just guarantee you a solid career, but actually let you, literally, save lives for a living? Because honestly, that's exactly what healthcare brings to the table.
Okay, let's get our definition straight first. What exactly are paramedical fields? Look, when we think hospital, our brains usually jump straight to doctor. But paramedical professionals, they are the absolute backbone of the whole operation. They're the essential pros assisting the doctors and nurses, handling patient care, running diagnostics, and supporting treatments. If they aren't there, the entire healthcare system just stops.
So here is our game plan for today. We're going to cover 1. Why choose healthcare? 2. Popular paramedical career roles. 3. Your educational pathway forward. 4. Salary, perks, and challenges. And finally, 5. The training action plan.
Section 1. Why choose healthcare? Well, to put it simply, this is a field that's virtually recession-proof. You're looking at a high-demand career with incredible job security, not just here in India, but globally. Millions of jobs are opening up because, let's face it, healthcare professionals are needed absolutely everywhere. Plus, and this is the best part, you get the daily opportunity to truly, genuinely help people.
Moving right along to Section 2. Popular paramedical career roles.
The coolest thing here is just the sheer variety of options you have. Like high adrenaline? Then think about being an emergency medical technician. You're right there in the ambulance, doing CPR, handling absolute emergencies. Prefer something more methodical? You could be a lab technician, running tests and preparing the reports doctors rely on. Then there's nursing, for hands-on patient care, or radiology techs if you want to operate those massive X-ray machines. There's even stuff like physiotherapy assisting or operation theater tech. Basically, there is a specific role for whatever fits your personality.
But, what does it actually take to succeed in these roles? Sure, you need basic computer knowledge, but it's really all about the soft skills. Communication, patience, deep empathy. You have to remember, you're often dealing with people who are having a really, really tough day. Throw in sharp observation skills and solid teamwork, and you've got the recipe for a great healthcare professional.
And your workplace? It is totally adaptable. One day you might be in a massive, bustling hospital, or maybe you'd prefer a quiet rehab center, a localized clinic, or a diagnostic lab. And forget just stethoscopes. This world is high-tech now. We're talking digital health records, telemedicine, specialized medical software, and yep, even AI. Honestly, you're going to be using a screen just as much as any traditional medical tool.
All right, Section 3. Your educational pathway forward. So how do you actually get there? It's a pretty clear ladder. Step 1, right after your 10th exams, is hitting the science stream for 11th and 12th grade to get those basic sciences down. Step 2 is where you specialize. This is where you grab a diploma or certificate course in something specific like nursing or lab tech. Or if you want a faster, highly focused route, Step 3 shows you can jump straight into ITI and vocational programs. Really straightforward.
Which brings us to Section 4. Salary, perks, and challenges. Let's talk numbers, because I know you're wondering. Entry-level roles usually kick off between $15,000 and $30,000 a month. But stick with it, get some experience, and specialize, you can confidently expect to be pulling in $50,000 or more as you move into senior roles. The financial growth is definitely there.
But hey, let's be completely real for a second. Every job has its pros and cons. On the plus side, massive advantages. It's a highly respectable profession, super stable, offers global opportunities, and gives you incredible personal satisfaction. But the challenges are real too. We're talking long working hours, sometimes crazy shifts, and absolute emotional stress. You are dealing with life and death after all. Oh, and medicine is always evolving, so you'll be learning continuously. It's demanding, for sure, but totally worth it.
Finally, Section 5. The training action plan. To get you started, here is a look at a typical 8-week training roadmap. It breaks down the learning curve beautifully. Weeks 1 and 2, nice and easy, just introductions and the basics. By weeks 3 and 4, you're diving deep into patient care. Weeks 5 and 6 are all about getting hands-on with actual medical equipment.
And wrapping it up in weeks 7 and 8, you are fully immersed in practical activities to really cement everything you just learned.
And speaking of those practical activities, what are you actually doing? You'll be right in the thick of it, doing live first aid demonstrations, actively practicing how you communicate with patients, and running through basic vital check training. You know, taking blood pressure, monitoring heart rates, the real boots-on-the-ground skills.
The final outcome of all this training? It's simple. You walk away with a rock-solid understanding of healthcare basics, a really clear picture of all the paramedical roles out there, and exactly what your career opportunities are in the medical field. You're not just guessing anymore. You're fully equipped to make the right choice for your future.
So, I'll leave you with this. When an emergency strikes or a crucial diagnosis needs to be made, are you ready to step up, start your training, and actually make a real difference in people's lives? The medical field is literally waiting for you. Thanks for hanging out with me for this explainer, and I'll catch you in the next one.